Anyway.
Okay, it is 5 p.m. I'd like to welcome anybody who is watching, and the few people that are sitting out here to the Indian River County Hospital District November meeting, regular meeting. We would like to start out with an invocation. With us today is Father Switz from the Trinity Episcopal Church. Father?
Let me just say it's a privilege and a pleasure to pray for this board and the very important work that you do to serve this community and its people. Let us pray. Almighty God, by whom the meek are guided in judgment, and light riseth up in darkness for the godly, grant these your servants in all their doubts and uncertainties the grace to ask what you would have them do, that the spirit of wisdom may serve them from all false choices, and that in thy light they may see light, and in thy straight path may not stumble. Through Jesus Christ our Lord. Amen.
Amen. Thank you so much.
Thank you, Father.
Thank you.
Michael?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We'll proceed with the consent agenda. I would like a motion for the approval of the chairman's meeting minutes dated October 17th, the regular monthly meeting minutes dated October 18th, and an October disbursement of Mr. Jones.
$1,108,446.90.
So moved.
Second.
Okay, all in favor?
Aye.
Thank you. I would like to open up the meeting tonight and to have all the trustees sing a nice happy birthday to our executive director, Anne Marie Soriano. So I'll start. Happy birthday to you. Happy birthday to you. Happy birthday, dear Anne Marie. Happy birthday to you. There you go. That's your raise for the year. All right.
No compensation.
Couple other things for anybody who is listening out there. We did, in fact, have published our first annual report for the hospital district, and they are available at the hospital district and being distributed through others. So if you want to understand what it is we do and who it is we pay and where the money goes, please make sure that you get your hands on one of those. So it's a very good book. Tuesday, we had a meeting scheduled with Dr. Edelman to talk about population health. They have asked to change the time of that and the date of that meeting to December 9th at 3 o'clock. So I know that there was members of the public who were intending on coming as well, if we can get that message out to do that. So
Do you think that should be published in the newspaper at all? Oh, okay, thank you.
8 will take care of that.
Good.
Okay,
A
so
lot of people were planning to come.
So please make sure that you put down December 9th, 3 o'clock, okay? I'm doing that. We have had a lot of discussion recently on the focus on mental health, and Anne Marie Soriano and I have had a number of discussions with the school district relative to pediatric and children mental health, and we are going to take a special focus on that. And get more involved, calling some people together, and so I'm sure you'll be involved in that as well. So just to make sure that everybody is aware of that. Okay, District Council report, Jennifer.
Okay, thank you for mentioning that. I was somehow missed that meeting got changed, so I was just fixing my calendar. Okay.
It happened this afternoon, so.
I don't know, didn't see it, but anyways, I'm glad I know. So this has been another busy month, winding up some of the matters with the Gifford Health Center as they are, winding and beginning their operation, the Treasure Coast Community Health operating the center. We now have all of the leases and subleases signed and in place, as well as the associated funding agreements, so we are square in that department. Again, I've reviewed all of the monthly meeting minutes and special meeting minutes of the past month, and then responded to questions from each of you as they've arisen, and have also worked kind of more in the background with Anne Marie and Mr. Jones regarding the surplus funds matter that I was asked to research, and will be presenting or reporting out the resolution proposed for your consideration tonight. Any other questions?
I did just want to add that I had a discussion with Bill Boyles the other day. He called to see how things were going and coming upon a year of the Cleveland Clinic coming in, and wanted to know how everybody was doing and all that. So he said to say hi to everybody and that he misses this group a lot. So.
Tell him we might be calling on him sometime in the
Someday
future
again, for something?
or something.
Well, I don't know of any reason we are, but okay. Anyway, just wanted to say hi. Next is our financial statement review. Mr. Jones?
Thank you. As you might expect, the district remains in sound financial condition. And in fact, as of October 31st, our bank accounts had a little over $4 million in them. Of course, we just approved spending about 1.1 million of that. So our net balance is just under 3 million as of October 31st. We had received no tax payments in October, but we have started to receive them in November. It's amazing how prompt Indian River County taxpayers are. In any event, we'll continue to draw down these funds until these tax payments arrive. Those payments have already started. As you review the financial statements that have been provided to you, you may notice a somewhat different format. In fact, this format is pretty much consistent with the previous statement presentation we've had in the past, but is a little more compatible with QuickBooks. And our new accountant, Cynthia Johnson, has recommended we go to this format to prevent errors. And Anne Marie Soriano and I agreed with CJ's suggestion, and it's been implemented and is in your package. That concludes the financial report at this time.
All right. Thank you. Any questions, comments?
Just
All
to
right.
say, a beautiful report as always.
Thank you.
I like the change in the reporting.
change
Yeah.
Yeah, I think it's good.
It looks cleaner.
Yep, looks much cleaner. Okay, you are up again for a Partners Program update.
You know, I'm really proud to do this. I think one of the most important medical efforts in the county is centered on the birth of children. And the district initiated a program in 1994 to confront an infant mortality crisis in the county at the time. Infant mortality is recorded as infant deaths within the first 12 months after a live birth. And in 1993, our county was a total of 12 per 1,000 live births, which was considerably higher than the state of Florida average at that time. Ultimately, in cooperation with Indian River Memorial Hospital, as it was named at the time, the Partners in Women's Health Program was established to provide initially prenatal care to any woman in the county regardless of her ability to pay. The program has been quite successful from its beginning in impacting infant mortality, but the most recent year, for which we have definitive data, 2018, showed terrific results, as infant mortality for the county was 1.5 versus state average of 6. I mean, when you think about that and where we were just a few years ago, this is an incredible achievement by the doctors, nurses, and staff that make the Partners program what it is, and they deserve to be really proud of their professional efforts. At the outset, I said I thought it was a really important program for the residents of the county. And Jenny, thanks for doing these slides, you and Kate, and I think I anticipated a bigger audience to view these, but nonetheless, in 2018, the total births in the county were 1,294, of which IRMC, Indian River Medical Center, delivered 1,070. So 82.7% of the births in our county were through Indian River Medical Center. Of those, 937, or almost 87%, were from partners. There are 2 private practice OBGYNs in the county, so they did the balance. But overall, because some patients choose to go someplace other than Indian River Medical Center, almost 3/4 of the births in the county are done in association with the Partners in Women's Health Program. So I think it's important to keep that in mind when you look at the data of 1.5 versus state average of 6 infant mortality rate. In 2015, the trustees, working with the Partners professionals, established a system of measurable performance targets to evaluate the treatment of patients. There are 10 items selected to measure, and they're divided into 2 broad categories. One is healthy infants, and the other is healthy mothers. So I think let's go through them one at a time. The first one is neonatal mortality. That is the unfortunate death of a child born in its first 28 days of life. So it's born alive but doesn't survive for more than 28 days. The Indian River County average for the last 3 years is 3.7 deaths per 1,000. Florida is 4.1. So with our program, we're considerably better than the state of Florida. But in 2018, that number was 0. So that's quite an achievement. And you can't obviously do better than that. The second metric that we use is the Cattell-Chuck Neonatal Care Index. This is a nationally recognized index of measuring the quality and sufficiency of prenatal care of mothers. 81.1% of the births, or the mothers giving birth in Indian River County in 2018 are judged by this index to have received sufficient or better than sufficient care. The Florida average is 70. So once again, the Partners is doing better than the state average. The third metric is first trimester prenatal care for mothers. Most studies, in fact, there are a lot of studies that reinforce the need to get prenatal care early in pregnancy. So our goal is to get mothers in the first trimester of pregnancy. 78.5% of the mothers in Indian River County get that care versus the state of Florida, 77.4. The fourth item involves breastfeeding initiated during hospitalization. If you could move the slide, maybe you're trying and it didn't do it. This is the only metric of the 10 metrics where we're slightly below the state of Florida average. 83.8% of mothers initiate this versus 86.2% of the state of Florida. The fifth metric is postpartum visits by mothers back to see the OBGYN at Partners. There is no state measurement for this, but we thought it was important for mothers not only to get prenatal care, but to get postpartum care. It's important to the health of the baby. So we established a standard. We want 90% of the mothers to come back, and this year 91% did. And the sixth metric is elective induction before 39 weeks. There are several studies that indicate that babies are much more likely to be healthy if they go at least 39 weeks. Of course, there can be emergencies or issues that occur that will require early induction to save the life of the baby or the mother. But in terms of elective, it is against the policy of the Indian River Medical Center and now the Cleveland Clinic Indian River Hospital to induce mothers before 39 weeks. So therefore, we had 0. And incidentally, Indian River Medical Center was the first hospital in Florida to receive the March of Dimes 39-week initiative award. So this is a nationally recognized achievement. The next element is healthy mothers. And the most important part, of course, is maternal mortality. We don't want mothers to die giving childbirth, not in this day and age. And in fact, we're 0. It's not very high for the state of Florida, but it's not 0. It's 17, actually, per 100,000 births. The next area that we measure was primary C-section rate. This is an issue nationally where, for various reasons, cesarean sections are used 30.8% of the time, according to the National Institute of Health. In partners, it's only 22%. Now, obviously, there are circumstances that arise where that's important to do a C-section, but you don't want to do it if you don't need to. So that is quite an achievement by partners. Similarly, the infection rate associated with those C-sections that are done in the hospital here in Indian River County is 0 versus 12% nationally, according to WebMD data. And then finally, we have a patient satisfaction measurement, and they give a survey to each of the 91% of the mothers that come back for postpartum care and ask them what they thought of the service from partners, and they asked to rate partners on a scale of 1 to 10. We measure the ones that give it a 9 or a 10, and 84.1% of the mothers give partners a 9 or a 10. Now, you might think, well, that's maybe not as good as it should be, and certainly there's room for improvement. On the other hand, most of the hospitals are given a similar question, and it's about 65% rate the hospital a 9 or a 10. So that 84% is really pretty outstanding. Incidentally, 89% of the mothers have responded to the survey, so this is a very representative result. Okay, the next part, no slides here, but there are 4 items of note that I wanted to share with you. First, Cleveland Clinic, Indian River Hospital, recently spent over $500,000 replacing furniture and equipment in the maternity ward. First time that's been done in 22 years. In addition, the board at Cleveland Clinic, Indian River Hospital has approved a $12.5 million capital commitment to completely refurbish and bring up to the highest standards of care the entire maternity ward. This capital raise would be led by the Cleveland Clinic Indian River Hospital Foundation, so all of us can participate if you like, but the board has guaranteed that this will be done regardless of the success of this, of the foundation. Talk about patient first. About half the births in the state of Florida, actually 48.2%, as well as Indian River County, 47.4%, are Medicaid eligible. Florida's Medicaid reimbursement is very low, particularly for maternity care. And often, hospitals are trying to get away from this cost of delivering babies if they can. Cleveland Clinic is doing the opposite. I think probably in part because taxpayers support this partners program. But certainly, Cleveland Clinic's doing it because it's in the best interest of the community to have healthy babies and healthy mothers. Third item, for the current year, the Partners Collaborative Committee, which is a group of one trustee, management of the hospital, and the lead nurse from, well, the director of women's health at the hospital, as well as doctors from the Partners program, meet quarterly But we've decided going forward to allow Cleveland Clinic and the partners professionals to establish quality metrics. We establish these in working with them. But measuring quality is in the DNA, so to speak, of Cleveland Clinic. And so we thought it best going forward for the caregivers and the management of the hospital to set the items to be measured. However, they will report to the district annually, at least annually, these results. And then finally, partners this year had as many as 6 OBGYN physicians, as well as nurses and other staff. After reviewing the program financially and listening to patient requests, decision's been made to gradually shift to 4 OBGYN, but hire 3 midwives
Yay.
to better serve patients. So that's the future decision. In any event, we should really all be proud of the fact that this district created the Partners in Women's Health Program and the impact that it's had on the quality of care in this county. So, thank you. If there's any questions, I'll be glad to address them.
I would just like to thank you as well for your focus on this program since the day you came in on this board, for real. And you have driven a lot of this, and I think that's really important. Also recognizing Healthy Start. I think they have been an important player in this as well.
Very much so.
And I think we need to recognize them. But
You're right about that. I should have had that in my report. Healthy Start actually began being embedded in Partners, I think it was 2015, but it might have been 14 or so, but it's somewhere in there. And they are doing a great job, and that's a key contributor to the improvement in these mortality data.
any other comments?
I think it's pretty exciting that in going through the process and choosing Cleveland Clinic and having maternity being part of one of the things that was so important to our community in that process, but to see them step up and make such a difference in a short period of time, I think kudos to them. I'm really excited for that.
I agree.
Any other comments? Mrs. McChrystal?
Just that hopefully the state will take some action and improve the Medicaid reimbursement, not only for OBGYN, but other disciplines where I think if you do your research, the state of Florida is probably one of the lowest for Medicaid reimbursement. It really puts a burden not only on the agencies that are taking care of these people, but on the people that have Medicaid insurance.
Thank you. Keep reinforcing that. Thank you, Mr. Jones. That was a very good report. It's good news. Anne Marie, Executive Director.
I don't really have any. I have submitted my written report to you, and we did a lot of the business yesterday that is included in there, and you already stole my thunder on the annual report, but there are some, for the audience that is here, there are some copies in the back of the room, and then obviously you can contact our office for additional copies of those, or even to distribute, if you would, throughout the community. So, thank you.
Good. Thank you. Okay, moving into our funded agencies report. We have New Horizons tonight. Welcome.
Thank you all, I appreciate it. And let me start by thanking you for your continued support for New Horizons. Support from this group has continued to allow us to provide high quality care to people of this county. So I want to start by thanking you. This report serves as a review of this period, as well as our...
Would you like to introduce yourself?
That would
for
be
those
very
that don't know?
helpful. I'm sorry about that.
That's okay.
My name is George Shoplin. I'm CEO and President of New Horizons.
Thank you.
And again, thank you. The slide you're looking at now indicates the first column is the number of services we provided over the year to date. And the second column is the funding amount for those services for the period we're reviewing now. And the third column being the year to date actual. The fourth column is important we put in to just show the differences between this fiscal year's funding and last fiscal year's funding. You will notice something unusual at the very top of unduplicated clients. There was a decrease, although funding increased. I kind of want to underscore that difference to any questions that may come. What we have is the unduplicated clients that for this fiscal year, the people we served, we engaged more fully and they received more number of services for a longer period of time. So the reimbursement for those services were higher. The decrease in numbers was related to a personnel issue we had, and again, trying to be completely transparent with you all. We had a provider that we moved in to the clinic who we had one very solid provider move to another part of New Horizons and replaced him. That provider really, her choice of behavior and interaction with the patients really led to people leaving our service. We attempted to remediate the situation over a period of time unsuccessfully. We separated from this provider because we want to make sure we're providing quality care to the people, and we've replaced her with somebody who is going to re-engage our clients, and we're reaching out to all the clients that disengage from us and trying to contact them and bring them back into the clinic. So that is the decrease we have. It was an unfortunate circumstance. We attempted the best we could to remediate it because of the issues of finding providers in our area. I talk about Medicaid reimbursement and things. It's difficult. It was unsuccessful. We really wanted to err towards quality versus just having somebody. So, but I wanted to make sure I spoke to that point in case there was a question. This next slide really talks to just a breakdown of the monthly averages, and what it does show at the very bottom is a 17% increase in the funding for the services provided. That goes back to the frequency of services. I see it as a healthy indicator of our ability to engage clients we serve, that they come back and they come back with some frequency and regularity. It avoids that recidivism, that decompensation we try to avoid at our end, so they're engaged in care for a longer period of time, which has better outcomes across the board. And then the last really are contributing factors. The majority of our clients are pre-qualified for the care card. 80% of our clients are referred by our community partners. And number 3 is what I spoke to about that provider. Number 4, all available indigent funding from DCF has been used. This budget cycle, we just actually executed our contract with our managing entity just in November, which is months later than the fiscal year started, just because of negotiations. There were some cuts we had to figure out how to manage, so it took some time to get there. So again, the funding you provide allows us to fill gaps that are created by funding streams that are out there that are feeling constriction. And then we are continuing, obviously additional funding continues to help. And then really lastly, just a line graph, and you'll see the blue line is this fiscal year. That dip is related to the provider. We really hit a peak. We changed providers, there was a dip on the change, and then the dip continued as we had that conflict. You will see that tail up for our next reporting period. Any questions for me?
So these numbers all refer to just the district qualified
Yes.
patients, right?
Yes.
What are you seeing in terms of just the overall need out there?
It's continuing to grow. You've talked about school briefly, you've talked about families briefly. I can say a bulk of my career is in the Northeast. In Florida, the need outweighs providers substantially. It's different up north. In Florida, probably because of reimbursement, probably because of geography, probably for a lot of reasons, providers are maxed out. Our services are maxed. We are actually beyond some capacity in some of our services. Given other resources, we would be able to expand and continue to serve more and more people when we're looking at how to do that effectively. And
Yes, my question is it because there aren't enough qualified professionals? Because the need is great.
you actually hit the nail on the head. What we run into is finding licensed, qualified professionals. The provider I'm speaking about is a psychiatrist. They're very difficult to secure. They're very expensive to secure.
Right.
So it is finding those. The other piece of it, and it's a variable, and it's a good variable. We spoke about schools. The schools now receive money from the state to provide therapy within the schools to provide a safer school. But what the schools provide is a 10-month work year, Christmas, Thanksgiving, Easter off, weekends off, and your phone will never ring after 3 o'clock. And their pay is higher than the community providers. So community providers are finding it harder and harder to find qualified professionals because the school districts are an attractive option. What we're attempting to do kind of across the board is begin doing some partnering with the schools. And how do we partner with the schools so that we can assist them in defining the new resources they found? Their job and their expertise is education, and that's what it should be. Our job is care. And a good strategic partnership allows us to deliver that care in a way that we can maximize the funds they did receive and allow us to provide the care that we're trained to do. New Horizons has done it for 60 years, 61 years coming up. So
let me ask you a question.
sure. I got a lot of soapboxes. I got to be
Okay,
careful.
but, I keep trying to, if you had the funds to procure more providers, could you get them?
Most likely. We are a large agency, and I hate being that evasive. We're a large agency. We do well at recruiting. We've changed, since I arrived, we've really changed from recruiting for our higher level, our psychiatrists and our physicians. That has led to a cascading opportunity where we get more and more. Once it starts positively cycling, we get more referrals. So we can identify other providers. It is at the therapist level, the licensed therapist level, that we really run into some issues. If you go to an unlicensed therapist, and I don't want to get too much into the weeds, but a licensed therapist, for billing purposes, you need a license. For working within certain agencies and auspices, you don't necessarily need a license. It's easier to find the unlicensed therapists. They're as qualified, they just haven't completed the supervision hours necessary. So yes, if additional funds are available, I believe because of our resources, we would be able to recruit qualified providers to provide the care.
Okay, so it's not necessarily a provider issue, it's a funding issue.
Yes.
Okay.
I think with a small asterisk, I think the smaller the agency, the more difficult it would be even if funding was there, simply because large agencies have a tendency to attract people. The small agencies have difficulty just because of being a small agency to attract people.
Right.
We just have a bigger footprint. And so it's just the name recognition sometimes will draw traffic to our ads more than others.
You look better on a resume. I
Yeah.
mean,
You know what? You're right.
Benefits.
You're right.
Yeah, it's more the benefits
Yeah.
and everything that.
That we have better
provide
benefits.
Rather than a
We
small.
we have more interns. We have ability to give them free supervision to get licensed. We have resources and abilities that other agencies just can't afford to do.
How about in the area of pediatrics? That, in talking to the schools and all that, they were saying that that is even much more difficult finding people, but,
You're getting into much more specialized service.
yeah.
And the
Very
farther you
good.
get into more specialized services, the more training and expertise and credentialing you need to get into that area, and you would want that. There's no generalist way to get there. So it gets more and more complicated as you get into that.
Do you have peds at New Horizons? I didn't.
We
think that-
serve children.
Do you?
We do have children outpatient and children
Yeah.
Baker Act receiving.
Outpatient.
And our Baker Act receiving inpatient, and
that
we do
right?
children's case management,
Yeah.
and we do a CAT team. And we have a lot of children's service. That's actually my bread and butter. Most of my
That
career has been with children, so yeah.
Other questions?
I could talk about New Horizons for hours.
We appreciate that, and we will be engaging you to have discussions about it.
I look forward to that. Thank you all very much. Have a good
Thank
evening.
you,
Yeah.
thank you.
Happy Thanksgiving.
Yes, any unfinished business, trustees? Okay, new business. We have the approval of Resolution 2019-03. And Mr. Jones, are you taking the lead on that?
Okay.
Okay.
I mentioned earlier that we're already starting to get tax revenues in. As a matter of fact, our bank account is now, I was told, as of this afternoon, up over $6 million. We don't need to spend that every month. So we've decided that we're going to invest it. And we had a discussion about this yesterday at the chairman's meeting. And we agreed, actually Anne-Marie Soriano and I have investigated the most effective way to invest these temporarily idle funds until they're needed to meet our obligations. And the trustees approved yesterday the intent to invest temporarily excess funds according to the following guidelines. One, only to deposit funds in institutions on the list of qualified public depositories that was provided to us. Number two, invest only in U.S. government agency, and/or FDIC-insured deposits. And three, all investments will be available on a daily basis for access if needed. So consistent with these guidelines, I would move the adoption of Resolution 2019-30 of the Board of Trustees of the Indian River Hospital District entitled Surplus Funds.
We don't need to read the whole thing, do we, Jennifer?
There were some
No.
changes though, right?
But yes, I wanted to point out a couple of things. We don't need to read it, and we can attach it to the minutes and incorporate it. But one of the things that I added after the conversation yesterday is on page 2, section 2, the paragraph that begins, after now therefore, based upon these findings and determinations. It's the last part of that paragraph. I indicated that this matter would be reviewed on an annual basis, because that was part of your discussion yesterday,
We did.
and it was not included in my initial draft. So I made that change. And other than that, it was just cleaning up my own edits and things that Anne Marie and I caught to make it read better. That's the only additional language I added that was not before you yesterday. Are there any other questions for me related to the resolution?
No, okay, we have the resolution. Do we have a motion for
So
approval?
moved.
Second.
All in favor?
Aye.
Any negative?
No, can we have discussion?
Or we can have discussion, yes.
I just had
Sorry.
sorry.
No, that's okay.
My initial concern was using this as an investment, and it brought a question to mind, and I was able to talk to Anne Marie about it, and explaining it's really not the same thing as like a normal investing. This really is like another bank account that will earn more interest. At the same time, I wanted to also consider that this isn't setting precedents to do a regular investing in the future, that this really is because we have surplus funds, and that we do review it on an annual basis and take into consideration that if there are excess surplus funds, that those funds would be considered going back to the taxpayers in the form of a tax reduction or something like that.
Or perhaps for the needs that arise in the community for organizations that,
It can be any of those.
I think the discussion of what the funds will be used for, or what we will do, is a discussion on a yearly
Right.
basis that we will have.
Right.
This is really the mechanism by which to manage it while we have those.
And I was very appreciative that we put in the annual basis review of this.
It also makes sense for us. If we have money in a regular bank account, which we do, and it's not earning interest, this money is basically available to us all the time to pay our expenses. So you may call it a surplus, but this surplus is a day-to-day, depending upon as the taxes are coming in and how we're spending it. And it makes a great deal of sense to do what we've just done. From the perspective of the taxpayer, as time goes on, and we are making money on this, we will be able to either accumulate or reduce taxes, or possibly both. And I think it makes a lot of sense to earn interest on your money that's sitting in a bank account, rather than not.
Can I just clarify, the reason we're using the word surplus is because that is in the statute. We've always referred to this as a board as the reserve funds,
Yes.
but that's where that word is coming from, and it is a little bit misleading, I think. But it's there for,
a purpose.
based on the statute, yeah.
Right.
So thank you very much. That's a great explanation. It really should put a lot of people's minds at rest.
And this is really the approval of the process that we're going to use to manage those, and who we're managing them with, so. Any other discussion? Okay, all in favor?
Aye.
Any opposed? No. Okay, the resolution is passed then. Thank you. Any other business? Any public comment? Yes, sir. Could you come up to the I appreciate it.
Tell us who you are.
Tell us who you are. and-
Marge, I'm a retired physician,
Surgeon,
surgeon, chief medical officer,
all of that.
Aetna medical director. But for our obstetricians to have to do emergency C-sections and take care of pregnant women and then their babies was with no prenatal care. It was just a nightmare, and it wasn't good for the mom or the baby. And I occasionally would get called in the middle of the night to help them because I needed 2 people when you do an emergency C-section. So we've gone a long way. And, I think we all can be proud of it. And as far as the child psychiatry and other things, this has been going on since I got here in 1981. We don't have enough child psychiatrists. And if I remember correctly, the behavioral health building was originally started as a for-profit pediatric psychiatric institute, I think. It had something, and the hospital was a part owner, but they couldn't make a go of it. And I'm just saying this is a tough problem for everybody, and I applaud your thoughts. We've got to reach out to multiple places, because when I was at the hospital, for Indian River Medical Center to find and keep a pediatric psychiatrist was almost impossible.
Yeah, very difficult.
It just is. So I think, it's going to it's going to need some kind of out-of-the-box thinking, reimbursement in general per Anne Marie. When I was in practice, it was about 25 cents on the dollar, what I normally got.
Mhm.
So for most physicians, you're losing money
Just a bill,
just to send the bill out.
right, just send
So-
a bill.
This is, and whether the people at Cleveland Clinic can help us in this,
We've started those conversations
I think
already
that's,
with them.
they're the people, they are the ones that have the multiple contacts and other things. So I'd just like to, just go along with that, plus the discussion not only for pediatrics, but for addiction stuff, which is,
Right.
as you know, a real problem. So thank you.
Well, we're happy that you're, in spite of retirement from surgery, you're still involved medically. Thank you.
Thank you. Any other comments? All right, we are adjourned. Thank you.
Great meeting.